Now, an urgent call for greater federal help to deal with the opioid epidemic. It comes from a pair of governors whose states have been hard hit. The governors of Maryland and Oregon came to Capitol Hill recently to speak before a Senate committee. In Maryland, the synthetic drug fentanyl was the leading cause of overdose deaths last year. And in Oregon, people 65 and older are overdosing and abusing opioids at a greater rate than any other state. William Brangham sat down with Maryland Governor.
As opposed to a criminal justice issue, and that it's so key that we focus on education, prevention, recovery, and treatment for folks that are suffering from substance abuse, particularly with opioids.
I mean, the president has declared this a public health emergency. There is $6 billion theoretically coming down the pipeline soon. What more do you want the federal government to do? Where do you want that money to go?
There needs to be resources behind those words. He needs to put funding behind the action, and we need financial assistance. We need assistance purchasing drugs that prevent overdoses from being successful, naloxone, and it's very expensive. And we need all of our first responders to have access to it.
This is the drug that reverses an overdose, that can be given immediately and bring someone back from what would have killed them, can save their life.
Yes.
Governor Hogan, you talked a lot about fentanyl. You mentioned it here, you mentioned it in your testimony today. Can you explain the impact that fentanyl is having here in Maryland?
Fentanyl is between 50 and 100 times more deadly and more potent than heroin is. And we're seeing deaths all over the place from the heroin. But this is it's a real crisis, and it's not just in our state, but it's spreading to many states across the country. And we had 2,000 people in Maryland die last year, and this was the #1 cause.
So obviously, a state can only do so much with regards to fentanyl. That's an interstate and international trafficking situation. So what do you want the federal government to do with regards specifically to that?
Well, the states can't do much about things coming in from China and across the border in Mexico. It started out, almost all of this was produced and sent in from China, and a lot of it is coming through the U.S. Postal Service, believe it or not. So there are a number of pieces of legislation here to try to address that, provide additional technology to try to interdict and stop this from coming in. And I think that's one thing the federal government can really focus on that we can't do at the state level. And I agree with Governor Brown. Treatment is the real issue, and getting more. $6 billion sounds like a lot, but in our little state, we put $500 million just into Maryland, and we still
$500 million in Maryland alone.
So it's not enough, and we need the flexibility, as Governor Brown said. We need the federal dollars, and we need to be able to utilize it as best we see fit out on the front lines.
Governor Brown, you mentioned today that you feel the federal government specifically focuses too much on punishment. What do you mean by that?
Well, we saw what happened in the 90s as a result of the crack cocaine epidemic. We ended up locking hundreds of thousands of people and put them behind bars. Their lives were ruined, obviously. It needs to be treated, this crisis, this opiate crisis, needs to be treated as a substance abuse problem, as a public health problem. And that means making sure that folks have access to treatment. If folks don't have access to underlying health care and to substance and alcohol treatment, we can't solve this problem.
Yeah, I would agree with that. It's really, we've been focusing on it from the 4 different areas. It's education and prevention and treatment and interdiction, because you can't ignore the crime part of the dealing of these drugs and that are coming and killing people. But most of our money has been put into treatment, and this is a mental health and health crisis. It's very connected with mental health, but it's a health crisis across America. It's the #1 problem we're facing.
This issue touches every single one of us, our families, our friends, our communities, our businesses, in every single corner of the United States. Every state has been impacted. This is an opportunity for Congress to step up. Republican and Democrat work together and tackle this crisis, and we need the help at the state level. I think Congress is committed to doing something. We'll see what happens.
Yeah, I couldn't agree with that more. You know, Governor Brown and I are different parties, different coasts, opposite ends of the country. We don't agree on everything, but this is one that I think nearly all of the governors in America agree on, and I'm hopeful that maybe this will be one of the things that actually gets done here in Washington, because we need to. It's about saving lives.
You both have given very concrete examples of things you'd like to see: health insurance, treatment, interdiction, etc. What role do you think that the simple shame and stigma around addiction, that it's very difficult for people, even though we know the science is crystal clear on this, to simply say, I have a problem, my family member has a problem, my coworker has a problem? How serious is that?
I think it's a very serious part of the problem, and something that we're working hard to try to change, because this really is, it's a health crisis. Addiction is not, you shouldn't be ashamed to come forward and get the treatment that you need.
And I think that's one of the challenges if the federal government continues to pursue a punitive approach, is that it makes it really difficult to erase the stigma of folks who are suffering with this illness. That's exactly what it is. It is an illness. And part of reducing the stigma, I think, is treating it like it is part of a public health issue that it is, as opposed to treating it like it's a criminal justice issue.
It's not just young people. Many of our addicted folks are older, because they're the ones that had more surgeries, more aches and pains, took more pain medications, and got addicted. It's not just an urban problem. It's every economic, every age group, every socioeconomic group is affected by this.
That's why I think it's so important for all of us to share our stories. We have all been touched by this horrible disease. What the difference is that we can all do something about it.
All right, Governor Hogan, Governor Brown, thank you both very much.
Thank you.
Thank you.